that note, I'd like to invite our first presenter. I'm just going to get that out. Camille Orridge, who's going to speak to us about her vision for a just and equitable future in a post-COVID society. Camille is a senior fellow with the Wellesley Institute and has a very long history working on health and health equity in the Ontario health system. Welcome, Camille, and thank you for joining us. Okay, Camille, I believe you'll need to unmute yourself using #6.
My apologies. Can you hear me now?
Hi, Camille.
Sorry about that. The question I'm asked to respond to is, what is your vision for a just and equitable future post-COVID-19? I thought about that, and at the risk of sounding like an angry black woman, I cannot answer the question without looking at the current situation, often referred to as normal. The COVID-19 virus pandemic has stripped bare the racial and class divide in this country. COVID has shone a light on the underbelly of our society. What we are experiencing is a culling of our society. No individual, no politician, no policymaker, no organization or institution has publicly said their intention is to cull our society. However, the culmination of years of decision-making, what gets funded, what gets priority, have all contributed to this situation of culling. We all knew this. If you do not believe me, take a minute and look at who is catching the virus, who is dying. Look at who got the training and the personal protective gear and when. Long-term care, group homes, congregate living for people with mental and physical disabilities, along with staff that provided care came after. We knew from SARS and H1N1 that they were the most vulnerable. The care staff are mostly women, women of color, immigrant women, and poor women. They took the disease home to their families. I now want the data of the healthcare workers that got COVID. So going forward, step one, I think, is a question that needs to be asked and answered. I don't think we can move until we have asked and answered this question. Are we going back to normal? Normal created the problem where we are today. Are we going back to normal? Or are we actually going to create a new normal? So my view of a new normal is that we would actually invest in the determinants of health. We would prevent infection, the prevention of infection protocols. They should be the same in acute, long-term care, group homes, shelters, prisons, etc. We should focus on where we know the spread will occur. There isn't anybody in public health, in regional planning, that didn't know after SARS and H1N1 that care settings were priorities, and yet they did not get priorities weeks later. We need to invest in affordable housing, and that affordable housing needs to include housing for the working poor, affordable rentals, housing and support for mental health disabilities. We need to increase full-time employment for staff providing care in all settings: home care, long-term care, group homes, shelters. This notion of these women having to cobble jobs together just to survive. Part-time workers in all industries should have access to benefits, including pension plans. We should not have these people working their entire lives and then retire poor. We need to create systems that provide a living wage. We started it, several governments came in and stopped it. In short, the outpouring of funds that we now see need to be redirected to the determinants of health. The cynic in me says, if we're finding the money now to do all this outpouring, how come we couldn't find the money to have addressed these issues over all the years we've been talking about determinants of health? Finally, the findings of the Black Experience in Healthcare Symposium, bringing together community and health systems for improved health outcomes, This was held here in Toronto, January 30th, 2020. That report is out today. Before the end of this, I will give you the website that you can go and get it. And those findings need to be implemented. And during the questions and answers, we can come back and talk about some of those findings. I figure others would have way more information about what the new normal should include, but these for me are the priority ones that should be there. If we don't do these, we are actually implicitly agreeing with a culling. Thank you.
Thank you so much for that, Camille. I think you're talking about this calling, right, and what we can all do to start to continue, I would say, to respond to this. I think you also acknowledge in the fact that we have a history of assessing, like doing this post-mortem on pandemics, so you name H1N1 and SARS, and then not really doing the full work to implement some of those recommendations. And so hopefully what we're going to see post-COVID is a more forceful and more persistent movement to keep some of these, to implement some of these action determinants of health which you're mentioning. Thank you so much.